I'm Dr. Brona Roberts. I'm a consultant chemical pathologist in the Belfast Trust. As far as cholesterol itself is concerned, diet and lifestyle modification makes some difference to your cholesterol. But if your cholesterol is high and your diet is already reasonably healthy, it's unlikely that you're going to be able to get your cholesterol down to a good level through dietary modification alone. If you're at high risk of heart disease, it's likely that your doctor will at some point suggest that you go on to a tablet for cholesterol. There are a few different types of tablets available for cholesterol. The mainstay of tablet treatment for cholesterol reduction is the statin group of drugs. These have been around for over 35 years, and at the minute it's estimated that around 200 million people across the world are taking statins to protect their heart. If you go onto the internet, you will of course find some reports of side effects of statins. The most common of these would be muscle side effects. Some people do find that when they start statin treatment, their muscles get sore. But we don't know who is going to experience this before they try them. If you do start a statin and find that your muscles or joints get sore, it would be important to ensure that it is related to the statins. You may be at an age group where you are developing arthritis or other health problems that can also cause musculoskeletal problems. It may be a good idea to stop your statin for a week or two and then restart it to see if it is indeed the statin that is causing the problem. If your pains resolve, then it's likely that it was the statin and we may have to look for something different. If, however, you don't notice any marked improvement in your symptoms, then you should probably go back onto statin treatment in order to get the cardiovascular benefits. Ezetimibe is another agent that can be used for cholesterol reduction. Ezetimibe is most commonly used either in people who can't take statins or in people whose cholesterol is still high even though they are on maximal dose of statins. On its own, ezetimibe is not a very powerful tablet. It's safe and has very few side effects, but if your cholesterol is high, it's unlikely that you'll be able to get your cholesterol down to a good level just by taking ezetimibe. As I've said, statins can affect the muscles, although serious muscle damage is very rare. If you do have to come off the statins because of muscle side effects, another option available is bempedoic acid. This is quite a new tablet which was developed a few years ago, and it has been designed to be like a statin but not activated in muscle. In other words, it shouldn't give you the muscle side effects. This seems to work well. There are quite a few people who have been unable to take statins because of muscle side effects, but they are able to manage bempedoic acid, and there is evidence of good cholesterol reduction and improvement in cardiovascular outcomes for patients on bempedoic acid. There are also injectable treatments for high cholesterol. However, by nature, injections are more expensive than oral tablets, and this is especially the case if they have to be given by injection by a healthcare professional, either at your GPs or in hospital. For this reason, national guidance restricts access to the injectable cholesterol-lowering treatments to people who already have had a heart attack or stroke and whose cholesterol is still high, even though they are on maximal doses of tablets. Injectable treatments are only available on prescription by hospital specialists. So if you would like to try an injection for cholesterol or feel that you would be eligible, you would need to speak to your GP first and be referred into a hospital specialist. You would then have an assessment to see whether or not you are eligible and suitable for treatment with a cholesterol-lowering injection.